Welcome to the Pulse of Change. I'm Dr. Abdulelah Alhawsawi.
And I'm Dr. Azhar Ali.
Welcome to the Pulse of Change, where we explore the ideas, leadership, and systems shaping the future of health. Today, we're honored to be joined by Dr. Mariam Jashi, the first CEO of the Global Sepsis Alliance and a global leader in health policy and development. Together, we will explore why sepsis is not just a clinical emergency, but a global policy and equity challenge that demands urgent action. So, Dr. Jashi, welcome to the Pulse of Change.
Thank you very much, Dr. Abdulelah, for the invitation. The pleasure and honor is all mine to join the Pulse of Change, and I look forward to very interesting discussions.
And I stand corrected. I said William. I meant welcome to the Pulse of Change, and this is our second episode. So thank you very much for being with us. So let's get right to it. Your career spans humanitarian work, global policy, and now leading the Global Sepsis Alliance. What key personal or professional experiences most shaped your commitment to global health leadership?
Thank you. It's difficult to speak about oneself during the podcast, but I will try to be as brief as possible. So I've been in global health for 27 years, and even at the time of medical school, I realized that public health was the area that was interesting me the most because of the impact, the potential impact your work can play in terms of saving lives and preventing disease and disability. And I was fortunate enough to join UNICEF in very early years of my career. I started with UNICEF office of Georgia, then as the special mission in the occupied Palestinian territory and New York headquarters, 11 years with the United Nations, in both in UNICEF and representing UNAIDS. Then 8 years in the government as the Deputy Minister of Labour, Health and Social Affairs, Member of Parliament, the Chairperson of the Parliamentary Committee, and international engagements as the Secretary General of the Medical Women's International Association and board member of Unite Parliamentarians Network for Global Health. What has influenced the career path was the unique opportunities to make a difference. My very early years were the management of immunization program. That is one of the most cost-effective and the best public health intervention in the history of medicine. HIV, TB, and malaria programs that we leverage from the Global Fund, Gavi. And we literally had the opportunities to save thousands of lives through those programs. And through the global health portfolio, for example, one of the biggest programs that I had the honor of being part of through UNICEF was the prevention of mother-to-child transmission of HIV/AIDS, and we have mobilized substantial resources and technical support to 17 countries of sub-Saharan Africa and Latin America affected the most by HIV/AIDS. And those are the incentives and those are the rewarding experiences that can be hardly compared to any other opportunity. So I'm extremely grateful and humbled to be part of the global health family.
Well, there's a saying that life does not happen to you, it happens for you.
Yeah.
So now, transitioning to the Global Sepsis Alliance, can you share with us how you came to take on the role of the CEO of the Global Sepsis Alliance, the first CEO of the Global Sepsis Alliance, and what motivated you to lead this global movement?
Very frankly, I was not aware of the Global Sepsis Alliance before GSA. Through my colleagues and friends, they reached out whether I would be interested in considering the position. Of course, this was like an open competition with some excellent candidates actually competing for the position. And At first, sepsis costs didn't ring a bell because, unfortunately, even being in global health for more than 2 decades, we never realized how important sepsis is in terms of attaining the global health, universal health coverage, or sustainable development goals. However, diving deeper in the sepsis costs, you realize that this is the best investment case for strengthening national and global health systems, preventing millions of deaths, disability, and the disease, the cases, number of cases. And sepsis is the best proxy indicator how well health systems work, starting from prevention through diagnostics, treatment, and post-sepsis care. So sepsis is not a silo program like many other public health interventions. This is the best way of unmasking the complex challenges and gaps in national health systems. If you do sepsis right, then your health system is working well. So that was a huge motivation. And realizing that sepsis affects almost 15 million people every year and takes at least 11 million lives annually, you cannot ask for a better cause. So again, I'm grateful to my colleagues, the board members of the Global Sepsis Alliance, including Abdulelah, for making the decision and allowing me to be part of this amazing journey.
So 50 million people annually, contract sepsis. As you said, at least 11 million people die from sepsis. For people joining us who are less familiar with the Global Sepsis Alliance, can you just shed some light on how it works across countries and what is the theory of change within the Global Sepsis Alliance, especially under your leadership now?
Yes, with pleasure. So, Global Sepsis Alliance, briefly, is the largest advocacy and professional network fighting to end sepsis globally. We are represented by 122 member organizations. We first had institutional membership, though today any individual who would like to contribute to the fight can join us as an individual member of GSA. We are represented by 6 regional alliances. We have our branches led by excellent experts and advocates for sepsis in Africa, Asia Pacific, Europe, Eastern Mediterranean, Latin America, and Caribbean. And GSA's mission started by Professor Konrad Reinhardt, who is a true sepsis champion, global sepsis champion. And while being an intensivist in Germany, he realized that most of his patients were dying from sepsis and no one was working on the sepsis challenge from the global health, public health perspective. So 15 years ago, we have 15th anniversary of Global Sepsis Alliance. He established the GSA with immense support from Dr. Carl Fleckley, the founder of US Sepsis Alliance. Dr. Fleckley also was personally affected by sepsis due to the loss of his daughter, Erin, to this medical emergency. So through the support of Sepsis Alliance, International Sepsis Forum, and other international organizations, Global Sepsis Alliance was established. And over the 15 years, GSA has become the leading voice of advocacy and also, at some point, technical expertise. Global Sepsis Alliance established the World Sepsis Day movement. September 13 is more and more known globally among our colleagues, both in healthcare providers, medical universities in general, advocacy for sepsis. We have 54,000 stakeholders currently engaged in World Sepsis Day movement across 170 countries. And Another flagship initiative, Abdulelah, you're also often part of this important initiative. The World Sepsis Congress, our annual completely online congress that brings together global health leaders and experts from different regions and different also disciplines that are connected by a sepsis cause. And every year we are reaching at least 10 to 12,000 participants of the Congress, and we're extremely proud of that initiative.
Thank you.
Dr. Mariam, I'll come in and thank you very much for leading such an important area with the Global Sepsis Alliance. And, the numbers you've mentioned, 50 million, cases, 11 million deaths, these are massive numbers. So why, and from my perspective, a clinician, Abdulelah is a clinician as well. And, I have personally done work around, sepsis improvement using sepsis bundles, trying to improve the incidence of sepsis. But why is it important that this is seen as a system issue rather than just a clinical issue for clinicians to deal with? And why is it such a critical global health issue?
Thank you for this question, Dr. Azhar. So, as mentioned, sepsis is, as Jeremy Ferrar, the deputy director of the World Health Organization, said during the World Sepsis Congress last year, sepsis is the microcosm how well universal health coverage and health systems work. So this is one of the best indicators of the effectiveness of health system. You cannot invest only in a single time point in preventing or managing sepsis. It's the continuum of care, continuum of prevention, starting from immunization, water and sanitation, infection control measures, to early diagnostics, treatment, and post-care that actually matters. So sepsis management requires multidisciplinary and cross-sectoral response. In the best case scenario, sepsis national action plans and policies should be part of the broader health sector reforms and universal health coverage packages. That's where we'll have the best sustainability of action. And when we speak about systemic changes, what we actually need is, first of all, to work with governments, because without WHO and UN member states, without national health authorities, we cannot really make the systemic changes. We need national action plans for sepsis as standalone or integrated part of health policies. We need national sepsis clinical pathways, protocols, how to manage this medical emergency, both in pediatric and adult sepsis, because as you know, every hour matters when we have a suspected sepsis case. Every hour of delay in initiation of antimicrobial, intravenous, and other like sepsis bundle kind of approach increases the risk of death substantially. So timely and effective management is key. And that is why we use every opportunity of being at the World Health Assemblies at WHO or the UN General Assembly and related side events to advocate to governments and global health leaders to invest in sepsis.
Sure. And how important, it sounds like you're looking at this as a spectrum in terms of prevention of sepsis and obviously timely management, timely identification, and then management of sepsis. How important is the prevention part of this, and what should be policymakers be doing about preventing sepsis? What are the key things from a prevention perspective?
Absolutely. So as one of the challenges with sepsis is that the origin of sepsis can be diverse. Like heterogeneity is key. So sepsis can be originated from any type of infection, whether bacterial, viral, fungal, or even parasitic. And that is why, again, immunization is the best achievement of medicine. So any vaccine that can prevent the vaccine kind of preventable infections is key. So first of all, our message is that we have to ensure high and sustained immunization coverage, both in children and adults, based on the national immunization schedules. That is key. Second is the basic water and sanitation kind of principles, both in healthcare settings and in community, starting with hand washing and wash infrastructure. Can you imagine that at least 25% of healthcare facilities in low and middle income countries and overall low resource settings, they don't have even the clean water supply. So how can we speak about the higher standards of infection prevention? And of course, in case of starting with the wound management or any other risky exposure to infections, we have to be ready in terms of timely intervention. Upon early identification of sepsis signs, of course, antimicrobial stewardship is also part of the prevention kind of measure.
And is this something that, I mean, obviously some of those things you mentioned are primarily in low income countries. How does this affect high income countries? How does sepsis affect high income countries? And, what are the particular challenges for those type of countries?
Yeah. Azhar, frankly, even though low and middle income countries are affected the most, and we have 85% of the global sepsis burden in low resource settings, high income countries are also not performing well. Every country is challenged by sepsis. And I think that's also a huge, um, I would say, not opportunity, but possibility maybe for us to really advocate both in with policymakers in richer and more advanced healthcare settings. For example, in the United States, every year, 350,000 people die from sepsis. And even in the US, where, of course, the quality of healthcare and the technological advancement of medicine is one of the best, we have this challenge. And that's why our dear friends and colleagues, the founders of Rory Staunton Foundation, Kieran and Orley, they're fighting for changing federal policies, and they have just registered the Sepsis Act in the U.S. Senate. So none of the countries are protected. Every country has a challenge with sepsis.
And it sounds like that's a growing challenge, because I think it was the Lancet Global Health report last year was showing the numbers are even higher now and they're going up. So it's not going down, it's actually growing. Is that right?
I wouldn't say that the numbers are growing. I think that estimating the potential causes of sepsis, both direct and intermediate causes, the knowledge is improving. And those numbers, as we mentioned, 11 million deaths every year is the number that is acknowledged and recognized by the World Health Organization. So for global health dialogue, I think that is the number that we have to refer most relevantly. But in October, we received another groundbreaking publication from the Institute of Health Metrics and Evaluation colleagues that says that in 2021, 166 million people were affected by sepsis and over 21 million died. And we have to remember that was also the period of COVID. And as we know, almost 80% of ICU COVID cases had viral sepsis. So that also has to play the role.
Yeah. So in the context of, and we're sitting in Saudi Arabia at the moment, and there's a large national transformation going on, and similarly there are other countries globally and regionally undertaking these transformations. So in that context, how can sepsis be embedded into these transformations, particularly when you talk about things like digital health and precision medicine and genomics and various different things, but how can sepsis be embedded in to these type of transformations, and what should policymakers and leaders be thinking about when they're thinking about designing and moving forward with these transformations?
Um, as mentioned, sepsis affects almost every field of clinical medicine and public health. So when we speak about digital transformation, starting from the clinical management aspects, um, we have very promising data that artificial intelligence enabled tools can detect sepsis cases more timely with better precision, especially in areas where we have a limitation of human resources in health. And on the other side, in terms of modeling and estimations, of course, from clinical epidemiological side, digital transformation also plays an important role. So definitely AI integration is important. And in terms of precision medicine, more and more we have evidence that calls for pathogen agnostic. What it means, since not only healthcare providers might be listening to us, it's like irrespective of the pathogen, irrespective of the infection that was the primary source of kind of sepsis, we have to be ready with personalized approaches to patient care, because what we see is that as immune system response is one of the challenges during the sepsis management. And I'm sure you, as the medical officer, and Dr. Abdulelah, know the details more. But we have to be ready, both with antimicrobial and immunomodulatory plus precision medicine approaches to save maximum number of lives.
Sure. Okay, great. So, are there examples of countries or health systems that are doing this better? Are they managing sepsis and actually implementing, particularly at a policy level? And who are those, and what can we learn from those countries or systems?
Yeah. So we're very proud that 2 years ago now, we already, in 2024, we launched the first global strategy, the 2030 Global Agenda for Sepsis. And this is the document that consolidates the evidence, the best practices, lessons, as well as the 5 strategic pillars, how we have to move ahead. And the document also summarizes 15 countries who have done much better than others. Unfortunately, we cannot speak on the majority of countries. We only have 15 countries identified from whom we can learn. And one of the countries is Australia, who through the quality assurance project in the Victoria State and introducing could it be sepsis approach on the front line of healthcare, they have halved the hospital mortality from sepsis. United Kingdom is another example, and Dr. Ron Daniels, our esteemed colleague and founder of the UK Sepsis Trust, has done a brilliant job in UK, even though even today UK is facing a lot of challenges. What UK colleagues have achieved, we would wish to see in any other countries. For example, they have the whole campaign engaging the ambulance services with sepsis posters in terms of awareness raising and much more. The national guidelines, continuous update of clinical guidance, training of healthcare providers. So UK definitely something that we can look after in terms of clinical work. British Columbia in Canada also had the sepsis focused quality care program. And, the return on investment and the number of lives saved are astronomical and extremely impressive. So we definitely have countries to learn from. And I would also like to mention that PAHO, the Pan American Health Organization, that is managing the global health kind of portfolio of WHO in Latin America as well as North America. They were the first region to have the regional strategy for sepsis, and we're extremely proud. We're thankful to Dr. Barbosa, the PAHO director. And we also look forward to the regional call of action in Eastern Mediterranean, led by the Eastern Mediterranean Sepsis Alliance from the recent Riyadh meeting in September 2025. And we are also very proud of the recent achievements. For example, the CEO of the New Zealand Trust, our sepsis survivor in Spain, Mariana, our Irish Sepsis Foundation colleagues, they have taken actions. During the World Sepsis Day, for example, they all had bilateral meetings with their respective ministers of health. And so that's the multidimensional action that we have to take.
And you mentioned the PAHO and this regional. Is that something that you think there should be more of than coordinated regional action rather than individual countries? And how can that accelerate things?
Usually when you have the global call, the regional calls, it facilitates national country level processes. So, for example, last year in Lancet, we had the publication, the call to action from patients in Europe for development of the European Sepsis Plan. And then we had a meeting at the European Parliament. So those regional action plans definitely are very important facilitators of change.
Okay. And how about some of the examples you mentioned were UK, Australia, so higher income. How about, are there any rising stars or exemplars in that low income setting, which obviously you mentioned is an important area? Are there systems that are doing something that people can learn from?
Fortunately, we do not have too much examples from low and middle income countries. And we call it the paradox of sepsis, that we have the biggest burden in low and middle income countries, and we see data generation, action, and policies in high income countries. But I would definitely mention our colleagues in African Sepsis Alliance who are engaged in the STAIRS consortium or other international programs and doing some very important work in Uganda or Kenya and other sub-Saharan African regions. And even despite the challenges in Sudan, for example, our colleagues have done a lot in terms of sepsis awareness. So I do believe that we can make change in every country. We just need champions, and we're lucky to have a lot of committed leaders as part of the Global Sepsis Alliance. And that is why we're so hopeful we can make this breakthrough of change.
And Mariam, you mentioned awareness. I just want to go back for a bit to, you know, the Rory Staunton story. If you can just talk a little bit about it, and the reason I mentioned that is I hope that many of the people joining us and listening to us are not necessarily just from the healthcare system, but from the public. And we want to tell them that actually they matter. Not only they can actually contribute a lot. So can you speak about the Rory Staunton and how that story actually tragedy transformed sepsis in the United States?
Absolutely. Rory's story is the tragedy of an amazing family. Rory was 12-year-old, and after his game, actually, the sports game, he came home with literally a scratch. And despite the fact that family took action and took Rory to the clinic, the healthcare providers couldn't really identify that this was something that could be progressed to sepsis. And that's when the tragedy happened. Kieran and Arlie, again, you would be amazed to meet the family. They became the warriors against sepsis. And one of their missions was to raise awareness because they didn't know about sepsis when this happened. They haven't heard about sepsis. And they realized that people not only were not aware of sepsis, but even the healthcare providers were not very much advanced in their knowledge and early identification. And their first mission was at the level of the New York State in 2016 and 2019. They supported the sepsis quality care initiative that was like a focused training and quality assurance project across the healthcare providers in New York State. And it is estimated that only this project has prevented 16,000 deaths from sepsis. And that is a beautiful example of the family who took the flag and really fought for the cause. And the next step was to take this initiative to the federal level. And they're currently working with the US Congress and Senate to adopt the Sepsis Act to make sure that the sepsis quality assurance program is mandatory for all healthcare providers in the US. And unfortunately, till today, most of our sepsis champions and leaders are patients, sepsis survivors who have been affected by life-changing experiences. We have amazing sepsis survivors, Shahrazad from Sweden, Ilse, Michael, Krista from Belgium, who are really very strong voices. And also the family members who have been affected by tragedy. Duncan Brown, the father of Con Brown from Australia. Till today, families have to fight because the awareness and the call of urgency to act against sepsis is still not there among policymakers. And we're extremely grateful to our dearest friends who are also part of the Global Sepsis Survivor and Family Committee. And many of the actions, either in UK, for example, as you have heard, Martha's Law is the new law adopted by the UK Parliament, where the families can have a stronger say in terms of assessing patients. Again, Martha's Law happened after the tragedy. And Mirope, Martha's mother, is an amazing person, journalist, and the fighter for this cause in the United Kingdom.
Thank you. I really wanted just to highlight that because, you talked about 350,000 people die in the U.S. Annually from sepsis. It is still out there. I have actually personally 2 family members from our extended family who died, from sepsis. So it is a big problem. But I think I'm very always keen on making sure that we send the message to the public that their role actually really matters, and it starts with them being aware. So yeah, I think we and the story of the Stauntons is an example of actually that how much an individual family can do, let alone a community. So switching gears and moving to the financing aspects. Globally we spend 10 trillion US dollars on healthcare. How do you describe the current global financing landscape for sepsis, and what needs to change to accelerate impact. I hope that whatever you say can, reach to the decision makers and policymakers
Yes.
across the globe.
Yeah. Thank you, Abdulelah. This is one of the most important questions because as the global health person, that's my mission. We don't have any financial architecture around sepsis because sepsis is not visible in global health or financial architecture. We don't have any earmarked funds for sepsis that can support national governments or international organizations to tackle this problem. And what is amazing and shocking is that we're speaking about the cause that takes every fifth death. Every fifth person globally dies from sepsis, and we don't speak about sepsis in every fifth forum or every fifth declaration or the General Assembly sessions of the UN or WHO. And that's what we have to change. When we speak about the financial architecture, of course, the starting point is to make sure that sepsis is part of universal health coverage and its funding is also embedded in universal health coverage packages, primarily supported by national governments or national health insurance plans, public or private, whatever is working. Any healthcare package should include sepsis management. In many countries, it actually is, but usually when you go deeper in terms of costing and unpacking the packages, the funding is not sufficient. So that already compromises the quality of treatment of the septic patients. Second, in terms of international call, you know that Gavi, for example, or Global Fund, now, or the international financial institutions like World Bank, regional development banks, they have health system strengthening and health sector support grant or loan portfolios. Our ultimate goal is to make sure that governments realize the importance of investing in sepsis, and while applying for international development assistance, they also consider sepsis as integral part of their national health packages and applications. For example, Gavi or Global Fund have the Health System Strengthening Grant Portfolio, and we can work with the respective global public-private partnerships and make sure that those windows also consider applications that can improve this cross-cutting sepsis prevention and management aspects, especially considering the importance of immunization as the primary prevention measure of sepsis. And even though we had discussions with the World Bank and other international financial institutes, again, everything starts in global health policies. Everything starts from member states, governments. That's why once the governments are realizing and acknowledging the importance of the sepsis in the improving the outcomes of their national health system and saving lives of their citizens, then IMF, World Bank, or any other financial architecture players will follow.
Well, during my time when I was leading the Saudi Patient Safety Center back in 2020, we had the G20 presidency in Saudi Arabia, and the Saudi government commissioned the OECD to provide a report about the economics of patient safety. And guess what? 13% of the healthcare expenditure was found to be, wasted, from preventable harm. And actually, sepsis was part of that, preventable harm. So you're talking about 1.3 trillion US dollars annually is wasted. Can you, do you think that we probably, in this fight against sepsis, we need to engage health economists and we need to do some specific, because what I learned is if you want politicians to listen, you have to talk about the money. And I think if we can have some specific, economic impact work for sepsis, and, the return on investment, I think this is where you can maybe get traction. Have any thoughts?
Absolutely. And that's why when we speak about the investment case for sepsis, we need better economic data and return on investment, actually. Unfortunately, like price tagging is something that might not sound very kind of global health related term, but it's very often used in terms of convincing the governments and the global players in investing in health. As of today, what we know is that on average, every sepsis patient costs €36,000 globally. So preventing sepsis is key, and it's estimated that 3.65% of healthcare budgets are spent for sepsis. We do have those numbers, but I do believe that we need more consolidated sepsis investment case that could be developed with engagement of major international financing players. And we have to speak about this at G7, G20, as you rightly mentioned, Abdulelah, and Davos economic forums or spring sessions on World Bank and IMF. We have enough data, but I believe that we need to consolidate the knowledge better and to convince. And even though we will announce this in a few weeks after finalization of some of the final administrative processes. I would like to mention that the Lardell Foundation is the first foundation that has recognized the urgency of action against sepsis. They are extremely supportive of the sepsis cause, and very soon we will have the opportunity to start truly historic collaboration with Lardell Foundation through their support, where we will improve accountability of governments to sepsis substantially. Again, this is all I can speak now, but we will soon announce the details of the initiatives.
Great, exciting. So we you mentioned that financing is one of the priorities. What have been other key priorities for you, as a CEO of the GSA, and what early lessons have stood out in your kind of work, leading the global advocacy against sepsis?
Yeah. So first of all, we call the 2030 Global Agenda for sepsis to be the next success. The 2030 Global Agenda for sepsis slogan is making the next success story in global health. So we've seen how immunization, HIV, TB, malaria, hepatitis, and other global health priorities have advanced and really helped prevent millions of deaths and disability. And we have the ambition that if we do it right, sepsis can become the next success story. We already spoke about the importance of political commitment and financing. Three other aspects that are extremely important. First, investing in sepsis science, research and development. We need new vaccines, we need better diagnostics, treatment solutions, and care solutions, including AI, both from diagnostics and epidemiological or clinical management perspectives. Second, most of the countries who have succeeded in sepsis clinical management, they haven't invested substantial financial resources, but they have invested in education. So training frontline workers, those who have the first call of action in terms of identifying the initial signs, that's key. So everyone, starting from the ambulance to primary health care or hospital management, everyone has to be trained on the sepsis clinical identification. Can you imagine that the US study says that only 18% of sepsis cases were identified before hospitalization, even by the ambulance teams? So early identification. And finally, whole of society approach. Each of us can play a role. We all know that heart attack, for example, is a medical emergency, but almost no one knows that sepsis is also the medical emergency, and you have to really call 911 or 112 or any other emergency numbers we're using in the countries, because minutes matter in terms of saving lives from sepsis. And those are the priorities that we have to work together.
So, Dr. Mariam, as we kind of come to the end of our episode, what advice would you give to clinicians and health system leaders who are not necessarily in a policy-making position, but who may want to influence and policies, systems, priorities? What advice would you give to those people if they're listening? What could they do that's going to make a difference?
So maybe we could use the same kind of slogan, think of sepsis, whether you are the general practitioner in the outpatient clinic or working in the first aid, ambulance, or hospital systems. Please remember that sepsis is one of the most important challenges, and sepsis can be also one of the best performance indicators of your work. Please, if you would like to learn more about sepsis, please visit the Global Sepsis Alliance or any other important regional sepsis alliances or WHO resources. You can also join us in the World Sepsis Day movement or the World Sepsis Congresses, where you can learn a lot, the latest evidence, knowledge, and experience from different countries. And just please know that each of you can make a difference in sepsis, spreading the word, even establishing the term sepsis in our communities, and talking about sepsis already contributes to saving lives.
Great, thank you. So think of sepsis. So thank you very much, Dr. Mariam, for sharing your insights, your leadership. It's been a pleasure talking to you, really inspirational. And you're obviously on a very important mission and inspirational mission that if you make the sepsis the next global health success story, then that's going to have a big impact on saving lives. So we hope that just having this conversation on the pulse of change, we hope that we put a spotlight on this critical area. But thank you for all your work that you're doing globally. And really appreciate you taking time for this conversation. To our listeners, if you've enjoyed this episode, follow the pulse of change, share it with your network, and join this global movement to make sepsis a global health priority. See you in the next episode. Thank you. This is the Pulse of Change.
Conversations that move healthcare forward.